All right. So, hello everyone. I think we have a few people joining now. This is the Pectus Carinatum webinar. My name is Sean. I'm here with Sam Walmsley, the founder of the London Orthotic Consultancy. We're going to just give a few minutes for people to join the webinar, and then we'll start the discussion. Hello everyone. For those joining right now, we're going to get started in just a few moments. Just as a quick overview of how this is going to work. So once we get started in a few minutes, I'll kind of give a quick introduction of myself. I'll hand it over to Sam to do the same. And then we can kind of get into the meat of the discussion, where I'll ask Sam a series of questions about Pectus Carinatum and bracing. And then Sam may ask me a few questions about my experience with bracing. And then we'll leave some time at the end for Q&A. So for those in the audience, just so you know, on your Zoom screen, there should be a Q&A chat box, perhaps at the bottom of your screen. So feel free to click on that and type any questions you have at any time during this webinar, any questions you have at all, and we'll get to those at the end of the webinar. And if there's any personal questions you have or things you want to talk directly with us, you can email me or Sam after this webinar. And we can get to that after the session is over. And my email address will be sent to everyone who's attended in an email after this. But it looks like we have some people who have already joined. So I think maybe it makes sense to get started. Sam, does that work for you?
Yeah, that's great. Let's go.
All right. So hello again, everyone. My name is Sean. I'm a former Pectus Carinatum patient who went through bracing. Actually, I work directly with Sam here and the London Orthotic Consultancy. I was able to successfully improve my pectus condition as an adult. So just for reference, I started bracing when I was 26 years old. I finished at 27. It took me a year and a few months. And I'm happy to kind of get into that in more detail in the session. Sam, do you mind giving an introduction of yourself and kind of a background of your history with pectus and bracing and the LOC clinic?
Yeah, sure. Thanks, Sean. Hi, everyone. I'm Sam. I run the London Orthotic Consultancy. We founded the clinic back in 2005. And at the time, it was born out of a desire to do things properly in terms of just providing nice quality orthotics to our local population in where we are in Kingston upon Thames, which is in Surrey, which is just on the west side of London. And we slowly have developed a reputation for finding niche, unusual treatments that are done elsewhere in the world very well, and then bringing them into the UK. And Pectus was one of the earlier things we picked up on. It all started with a young boy attending or knocking on the front door of the clinic saying, "Can you," his mum did, fix my brace. And I took it in and I put a rivet back in it, and I gave it back to them and asked them a few questions, and they said, "Oh yeah, we flew to Brazil to get this," which I thought was just incredible. And so cut a long story short, I contacted the doctor in Brazil, a guy called Dr. Haj, who was the grandfather of Pectus conservative treatment, and he flew over a couple of times over a 2-year period, and we took on a load of patients, and he kind of gently took me through the process of treating those patients. So that's how I gained my initial experience. And then the rest, as they say, is history. He treats adult patients, or he treated, unfortunately he's passed away, he treated adult patients. And he taught me that actually you can treat adult patients as long as they have flexibility and compliance, which are two very important factors that we can come into later perhaps. But yeah, so that's how we became, that was how we came across Pectus. And then slowly over the years, we've then developed our own reputation for doing it.
Wow. And I guess, Sam, I'm just curious for myself, how much does your clinic focus on pectus as opposed to kind of some of the other conditions you guys work on?
Oh, I think it's probably 15-20%, maybe. We you see a lot of children for lower limb neuromuscular and conditions such as cerebral palsy, spina bifida. So we treat a lot of patients for that. We're very unusual in that we have a gait laboratory, so we really analyze people's gait very carefully, and we tune orthotics, which isn't really done in many places across the world other than in big institutions like hospitals, but university hospitals, but they don't see the same sort of clinical workload that we do. Yeah. And we also treat scoliosis, which sometimes goes hand in hand with pectus. We have a very innovative hyper-aggressive brace that we use for that. And we treat plagioccephaly, which is a baby's remodeling of babies' heads. And so in all these sort of niche, unusual areas, we've really tried to find the gold standard in the treatment. How do you do it best? And then we try and become experts in that. So as pectus evolves and grows, it has certainly kind of grown over the years, and we are seeing more and more patients, especially recently. I don't know if that's a consequence of coming out of lockdown or people becoming more conscious of these things and being prepared to put the time in to fix it. That's I don't know, but it's certainly a growing area of our clinic. Yeah.
Got it. Interesting. And I guess, yeah, so for the audience members here, I guess just to kind of give an overview of Pectus Carinatum in general and bracing and some of the options, I guess, can we start with the basics, I guess, can you kind of, I guess, explain to people what is Pectus Carinatum to begin with, and maybe, what do you think even causes the condition? And then kind of getting into what are the treatment options to fix Pectus Carinatum?
So obviously, first of all, Pectus Carinatum is a protrusion of the chest, and Pectus excavatum, which we shouldn't forget about because we see a huge number of excavatum patients, is a depression of the chest. But both of those go hand in hand with rib flaring as well. So often there's a flaring or an asymmetry of the ribs. So we shouldn't just think about the chest or the carinatum in its, by itself. We have to think about the whole chest shape and how we are going to, what it looks like and how we're going to affect it. What causes it? It's basically a disturbance within the growth plates of the sternum. So within your sternum, you have growth plates horizontally running up and down. And as you grow, you have growth plates in all your kind of bones. And as you grow, new bone gets laid down and the growth plate moves apart a little bit. And in your growing phase, if you were to take an X-ray, you would see those growth plates on the X-ray. And for some reason, there is a disturbance in that growth plate that causes the overgrowth or distortion of the chest wall. That can be respiratory. There's mentions of that in literature of like severe bronchitis or asthma causing these things. It can be impact and trauma, sport or very aggressive car accidents. It can be surgery, but a lot of the time it's what is called idiopathic. So there's no real known reason for it happening. So and in those, and I would say that's the vast majority of cases, and we tend to see it in that rapidly growing adolescent who suddenly it comes out of the blue, and their parents will come in and say, "Oh, this has just happened," or they go to their parents, or sometimes their friends at school notice it. That it does happen in younger children as well. We do see some younger children, and the early onset cases often go on to be the most severe cases in adulthood, obviously, because you've got to go through growth. And that's why you notice it getting worse through growth. And then as you get to sort of your, late teens, it's generally the deformity itself has reached its maximum, but some of the implications haven't stopped. So, for example, in your body gets stiffer as you get older, which is why the treatment becomes harder and harder and harder to complete. And that stiffness of a chest wall, if it's in the incorrect position, can cause people, the feeling of asymmetry, the feeling of that their posture is asymmetrical, they're causing them back pain, those type of things. But sometimes in the excavatum patients, they actually feel like they can't take a deep enough breath. So they really feel the restriction on their chest wall as well. So they're all reasons why an adult patient may come into the treatment for physiological reasons and not just the aesthetic reasons as well.
Got it. Okay, so, and I guess you kind of touched on it a little bit, but specifically for Pectus Carinatum, the protrusion of the chest, I guess, do you think, like, what kind of issues do patients typically deal with? Is it really just cosmetic and psychological, or do you see anything beyond that? I guess you kind of alluded to maybe posture issues and things like that.
I think that the big one is posture, because we know that patients with pectus carinatum, you don't want to put it on show to the world. So if you don't want to put it on show to the world, you retract your chest, which means you protract your shoulders, which means you get a large thoracic curve in your spine, and then your head drops forward and you sink back. And it's a posture that lots of people adopt, because it's a bit of a what we call hypertonic posture. It's like you're sitting in a chair but standing up. You've reduced your lumbar lordosis and you've got this big sway back. So that's a big problem. And in the extreme cases, you can really, it's profound, and it's almost more of the issue than the pectus carinatum itself. And that leads to back pain, just general social kind of well-being problems of not standing up straight, not looking people in the eye because you're kind of like you're slunched over. Of course, there are some other issues around it. Just in some of the extreme cases, you have quite a sharp protrusion at the base of your chest around the xiphoid process area. That can just be uncomfortable to lie on your front. I've seen lots of surfers who kind of like can't surf bodyboard because it means it just gets rubbed raw. But by far the biggest reason for people entering into treatment is obviously the cosmetic element, and trying to feel happier with their own body.
Right. Yeah, and I can definitely attest to that myself.
Yeah.
Okay, so I guess the next question I would have is for the audience, I guess. So what are the options in general? What are kind of all the options available to someone who has pectus carinatum and wants to correct it?
Well, I suppose you have the three basic options are leave it, live with it, brace it, or surgery. That's your three basic options. Within the surgery bracket, there's different types of surgery. I'm not a surgeon. You'd have to consult your local surgeon, but there are different procedures that may work. For carinatum, I think it's less commonly done now, because you have the decision to be left with quite a big scar down the front of your chest. So if you're concerned about the cosmetic element of your chest, having a big scar sometimes is not a great option either. With excavatum, there are different procedures that can leave less scarring, but they are major chest surgery procedures. So and there are some more cosmetic ones now for excavatum with silicone infills and things, but they don't sometimes address the physiological element of the problem, and very few address rib flaring as well, which often can in excavatum be 50% of the problem. So that's the kind of part of the surgery stuff. So, and within bracing, obviously we have a single brace, we have a double brace with the rib affecting the ribs as well. It is less common with my adult patients to do two braces. Often, I've learned that the hard way, that the two braces sometimes is too hard, and you have to do a single brace and really addressing that upper chest problem and accepting we're not going to get perfection, but we're looking for a better overall result. But with my adolescent patients, two braces is almost 96% of the cases, because you really can improve the concavity of the rib cage, just lower than the actual protrusion as well. So that's a kind of very common prescription. With excavatum, we use vacuum bells and we use bracing together to kind of pull out the chest and push in the ribs at the same time. And I think that's relatively, I don't like that phrase, relatively unique, but I think we are unique in doing that. And those results take longer. It's harder work, even than the carinatum cases, but it is possible. And then of course you've got leaving it, which, if it really truly bothers you, it doesn't leave you with much. It's not a great option, but sometimes when you look around and you ask the people around you, your loved ones, no one really cares about your chest shape. Now that's a almost unique, that's almost completely true across all of the patients that I see. Their friends and their loved ones don't care, but they do, and that's the big issue. Yeah.
Right. Right. Yeah, that makes a lot of sense. Okay, so I guess diving in a little bit into bracing more specifically, I guess, my first question is, I guess, how effective is bracing? Can you talk a little bit about that?
So bracing can you can get results. If we talk about the rods, you can get results of 100% or 0. So 100% results you would expect in patients who are very flexible, who have even the severe younger patients you can get 100% results with, but certainly you would be wanting to use 2 braces, and you'd be wanting to catch them at an age where you've got complete pliability of the chest wall still. But regardless of that, even if you've got exactly the right age and exactly the right patient, they still have to do it. And then then you have the social issues of them wearing a brace that generally play into a patient's mind. And part of our role as clinicians is guiding patients through that, and hopefully making them realize again that no one really cares about you wearing a brace. Like, they don't really care about your chest shape either, but they don't care about you wearing a brace. So if it's just for you, you might as well just fix it, because not doing something because of the way someone else might perceive it is not a great option.
Right.
So results are driven by compliance, and that's not a get out from our side. That's just the way it is. I can give you the right tools, I can tell you how to do it, but if you don't do it, it's not going to work. But compliance can be aided by us. So compliance can be helped with, regular reviews, talking through the kind of issues, exercise, driving the exercise message home, reviewing the pads, changing things. So you're changing the force and direction of some of the corrections and making sure that red marks, problems, issues, concerns are dealt with, quickly and efficiently. So people are wearing an optimum brace. The worst thing you can see is someone wearing something for, 2-3 months that's not really done anything. So ensuring that people are on point all the time with their treatment is a very good way to maintain compliance. But in the end, I'm not wearing a brace. It takes someone to kind of pluck up the courage and do it.
Right.
Yeah.
Right. Yeah. That's 100% true. And I remember I wore the brace for, close to a year and a half, and it's 90%, compliance, and, maybe 10% support and whatnot. And you've got to really want the change. And I think, like you said, I think it's really important to just not worry about what people think, especially, the bracing aspect is temporary. And so, if you just keep in mind that if you can push through it for a year, then you'll get, hopefully a lifelong result. And I can get into that more later. But I guess, so my next kind of question for you, Sam, is kind of like, I guess, can you talk more about how bracing actually works? Maybe with your clinic specifically, what does a patient have to do? What does it look like? What's the, how long, what's actually involved?
Yeah, so we talk about bracing as 2-3 phases. So the initial phase of treatment is to really maximize the flexibility of the chest wall. So the process, I suppose if we take a step back from that, first of all, you've got to engage and have a chat with us online, remotely, and we can talk about your chest, have a look at it. You can now send us 3D scans with your iPhone, so we can evaluate your chest in 3D whilst talking to you. So there's some quite exciting things with technology that have really advanced this and opened it up to more people. But once you've thought to yourself, okay, I want to do this, I want to, and you come to us and you engage us and we get you a brace. Then the journey sort of starts with you beginning to get used to it, which is, you can take 2 different approaches. You can approach it as I kind of advise people to, which is keep it on 23 hours a day and exercise like crazy and really go for it. Now, that works 100% of the time for the adolescent group, because if you give them a little leeway to kind of take it off a bit or build up, it just doesn't really happen very quickly. And the reason it's beneficial is that it's like if anyone's worn braces on your teeth or have ever had a kind of like a chip on a tooth or something, it feels like a chasm or something massive in your mouth for about 3 days, and then it disappears. It's like magic. It goes because your body kind of like just removes it as a sensation. It's not there. Yeah. And I think there is an element of that, not to the same degree, but an element of that happens with bracing. So if you just keep the brace on you, even if it's loose, and then tighten it, loose and then tighten it, you get an element of that benefit of the brace kind of disappearing after a while. But that's not possible in all cases. And in fact, a lot of my adult patients choose to build up a tolerance to it. And during that build-up phase, they're really building their flexibility of the chest. And they do that through exercise. And and I think probably since we went through that phase, Sean, I've changed things a little bit. It used to be that I used to kind of direct people with like a period of exercise a day. And now I'm sort of trying to say, look, what I want you to do is at any spare moment, I want you to do 30 seconds here, 40 seconds there, 30 seconds there. So before you clean your teeth, before you get in bed, after you get out of bed, after you do this, because all we're wanting to do is we want that chest to be, as you breathe in, you're constantly trying to massage that and push that chest wall in against the brace by taking deep breaths in. And when you start to see it happen, you can take deep breaths in your brace in the mirror, you can see your chest almost flatten within the brace. It's quite a good thing for you to see. Yeah. So once you go through that, so when you get to a phase when you're able to wear the brace 23 hours a day at the same pressure, and the chest is sort of completely flexible, then you go into the second phase of treatment. And what we're looking at there is we're looking at something called bony remodeling. And that is when your bones start to remodel into this new shape. Now, it's not a sort of thing that they just start to do. Your bones are constantly remodeling all the time. This is a law, something called Wolff's law, which is a very old orthopedic law, which states that, a bone is constantly remodeling, but it will remodel to a different shape if you want to apply a force to it. And so, there's been kind of things in history of people binding feet to create smaller feet, or necks being made longer, or heads being made longer, or so there's lots of instances in history of different civilizations even doing this to create different sort of bony structures. And but that remodeling process is happening all the time in all of our bones. It's just they generally stay the same shape because there's no real unusual abnormal forces being applied to them. But in your rib cage, if we can apply that force consistently over a 23-hour a day period for a period of time, and it's not long at that point, it's like 3 to 4 months ish, then we can get some remodeling, and that remodeling is what gives you then the ability to go into the third phase, which is to wean out. And that we do that over a slow period of time, increasing amounts, trying to see if your chest moves at all, and then just eking out more and more time until such time as you're completely out of the brace.
Interesting. Yeah. And then everything you said resonates very well with me. I remember every step very, very well. And I actually really agree with what you said about it's good for bracing patients to see their chest actually going down. So whether it's like you said, like 30 seconds of breathing exercise and literally looking in the mirror or looking down and seeing your chest flatten, I think it does create motivation. And I remember every little improvement I got every step of the way was definitely additional motivation, whether it's like, my chest was staying in longer for 30 minutes longer than it was last week. Those little things are really helpful. And another thing you said that I thought was interesting, and I definitely agree with, is just the losing of the sensation. I definitely can attest to that. After wearing the brace for so long, for so many hours a day, it kind of becomes a part of you, and it's almost like when you take it off, it feels odd. It feels like you're missing like a limb or something. So definitely agree with all of that. I guess maybe another question I would have is, what makes a good bracing candidate? I think you kind of alluded to it a little bit earlier, but can you go into more detail in your, you see so many patients, and you've seen so many patients over the years. What kind of separates, candidates who get, good result versus maybe those who don't?
So I think, the first thing that we look for is flexibility. I mean, that trumps age in terms of, you can have an old patient come to see you. I mean, I've got a good story of a chap who came to see me, and he came in. He was a big guy, full of tattoos, and kind of looked quite angry and mean. It's the type of guy you don't want to say no to. And he had quite a large chest shape, and I was thinking, and it was in his 40s. I think, oh no, you know, I'm going to have to say this is not going to work, and I didn't really want to, you know, you don't want to have to do that. And when I said, well, can we just check the flexibility of your chest? He said, oh, it's really flexible. Look, and he just pushes his chest in so super easily. I was like, that's incredible. How do you do that? He said, oh, every night I lie on a bit of wood and I just push my chest in. And he had basically just kept his chest flexible all the way through his life by lying on. Now, I don't recommend that, but it was probably one of the oldest patients I was able to see because he had maintained the flexibility of his chest. Sometimes we see excavatum patients who stand in the mirror and they blow up their chest and really push their chest out. And then they've always done it because they like the look of it. Yeah. And that leads to a flexibility that we can then harness within the treatment. So so the first thing is flexibility, and we can, you know, we do some simple checks to look at that and to see what it's like. The second thing and most important thing is then the compliance. You know, have you got someone who is kind of really up for it? Are they going to be prepared? And where are the pinch points? You know, wearing at home, wearing at night, yeah, that's all fine. That's, you know, but you know, are they going to be prepared to go out with their friends with it on? Are they going to be prepared to, you know, sit in the office with it on, or go onto the, you know, workshop floor with it on? Or are they going to take that moment and kind of accept that if someone asks them the question, they go, oh, I've got a bad back, or I've just got to wear this thing to improve my posture, or I've got Pectus Carinatum, I'm trying to fix it. You know, are they going to take that plunge? Because at some point they will have to, and at some point it's a deal breaker with the treatment. You know, like if you don't do it and you continually take it off at those moments and you lose 4 or 5 hours a day, that 4 to 5 months of remodeling period never really happens, and you're just perpetually in a cycle. Yeah. What tends to happen with me is patients don't do it initially, and in the end they just go, oh, I've just got to do this now. I just have to go for it. And so in the end they make the decision. But you know, some patients go for it straight away, and I've got, you know, a number of patients who go through the treatment in a kind of very fluid motion, and that should take roughly a year for adult patients, as it did with you. But so going back to the question, that, you know, so you've got the flexibility and you've got the compliance, which comes down to kind of willpower and desire, and, you know, and the ability to kind of make those difficult decisions. And then you've got other things like, you know, where in the chest is the problem, because, you know, if the chest is very high up, that's very hard to fix later on in life. If the chest is lower down, it's much easier to fix. But if there's asymmetry, that adds a layer of complexity to it. So those hurdles are, you can overcome those hurdles, but they are some complexity that might make it a little bit more difficult for the patient. So yeah, I mean, you know, sometimes if you're looking at, certainly if you're looking at children, you're looking for their, you know, their family. Are they going to get the support? Are they going to get some help with it? And often with children, you know, because they've been brought by their parents, do they even want to be in the room? If they don't want to be in the room, then you're probably not going to get a good result.
Right. Yeah, that's a really good point. Yeah, I think that the person who's actually putting on the brace has to want the change, because otherwise, like you said, those moments will occur where, okay, you know, I'm coming up to a point where, you know, I don't want to go into this room and my friends see I've got this thing under my shirt or something. And if you, like you said, if you take those moments and take the brace off and you consistently do it, you will lose progress. And I definitely had some of those moments myself. And I admittedly, there were a couple times where I, you know, took it off for like a 2-hour, 3-hour event. But I think, like you said, at some point you just kind of got to draw the line and say, if I keep doing this, then I'm going to prolong the cycle, like you said. So
I honestly think as well, whilst the world is becoming more preoccupied with appearances and you know, just through, you know, well, we know all the different types of media that do that, it's also becoming more accepting of people doing things to change their appearance, to better themselves, to improve themselves. And I think that's, you know, whether it's, you know, going under the surgeon's knife or doing fitness regime, or there are lots of ways that people want to kind of like really improve the way they look and be happy with themselves. And this is just another area. It's a bit more medical in terms of what you're going to go through, but and sometimes a bit harder, but it makes people feel better about the way that they look. That's it.
Yeah, exactly. It's really the best analogy is really just the braces for the teeth. It's kind of the same sort of process as well. I guess it's just such a much smaller population that has this condition.
Yeah, exactly. Yeah. And I think the teeth thing's really interesting, isn't it? Because you see now, sometimes you see old footage of I remember seeing some old footage of the Beatles on one of their recent thing that came out on when they shot their Get Back album. Their teeth were terrible. You kind of go, and nowadays that's just not acceptable in kind of like a media environment, isn't it? And so our perception of like teeth has changed over the years. Now a lot of people want them straighter, they want them whiter, and and they're prepared to be seen wearing braces to do that. Whereas before, years ago, that was not the case. So I think it is a very similar treatment from that perspective. But I think the world's becoming more accepting of people doing stuff and wearing stuff to change it. It's just that no one's really ever heard of Pectus Carinatum, unless they know someone who's got it.
Yeah, exactly. Yeah. I feel most people haven't even heard of the condition, but I can attest to bracing on the chest is, it's really a personal thing. And, if you can really, if you have the motivation to push through it and get a good result, and it really is, can change a lot of things for you. So Sam, I guess I have, one other question for you, and then maybe, I don't know if you have any, questions for me, but maybe I can talk a little bit about my experience as well for the audience. I guess my last question here is, I guess, is the improvement that patients get permanent? I know there's some people wonder, do I have to wear the brace forever, or does it pop back out? Is there a certain age bracket for which, maybe it's more prone to pop back out? Or can you talk a little bit about that?
Yeah, this is where it differs from dentistry, because in dentistry I'm told that you have to continue wearing your braces and have something called a retainer to maintain the correction that you get. Now, I know that some patients don't do that and they get their teeth fine, and some patients don't do it and their teeth regress. However, in this treatment, the driving force behind the original problem has to have finished. So we have to get you through the growing phase of your life. And for men, that's normally 16 and a half. For girls, sometimes, 16, 15 and a half, 16. Once you get through that growth stimulus, now that doesn't mean you've finished growing, but your height growth has finished. So the sternum has finished growing. Once we get you through that growing period, then the stimulus has gone, and then the corrections that we achieve will be permanent if and this is a big if we wean you out properly. So if we slowly take the brace off, and by definition we've left it on long enough prior to that, the remodeling process will create a permanent finished chest shape, and the driving force is gone, therefore it won't come back. Now in adult chest, what you tend to get is if you take the brace off and it's like your chest is 100%, it tends to just slowly come out to about 90. So to get 100% in an adult chest is so hard, and to get that last 10%, in most things that we do, the last 10% is the hardest bit, isn't it? But to get that last 10% would require such a monumental effort, and wearing it for even longer, that the majority of my patients are just very, very happy with the result that they've got. And then that's absolutely fine. And it's also the type of result where, and I talk about it with my patients, is we're not here to give you a kind of Men's Health magazine chest shape. We're here to give you a chest shape where you can take your shirt off and you don't think about it. You go to the beach, you don't think about it. And that's the biggest thing. It's how it affects your mind. So if you're taking your shirt off and you're not preoccupied, oh my God, what people are going to think, then that we've won. So where your chest shape is at that point,
right?
That's entirely up to you in your mind in
Right.
some respect. So, but that's our goal, is to kind of, it's a very subjective outcome measure to say, are you happier now than you were before? Are you happy without your shirt off? So, you know, are the results permanent? We we've never audited all our patients and kind of gone through and, you know, so seen if there's been regression. I must admit that, but our doors are always open, and we do see a lot of siblings. So we see a lot of patients. I've never seen an adult who's been through treatment who's had a child and been through treatment yet, but we've only been going with this 12 years. So I'm sure that will happen at some point. But we see a lot of siblings, and we have seen siblings who are now sort of, you know, 25, and their 16-year-old youngest brother, you know, has come into treatment, and the 25-year-old's doing absolutely fine. His chest is fine, and you know, I've talked to a lot of people about that, how their results are completely permanent, and they're all very happy. So and that's the evidence that, you know, that Dr. Harge had as well, that the once you get a correction and it's permanent, and by that, you know, whilst we've taken the brace off for a couple of weeks, we will know whether or not it's permanent or not.
Right. Yeah. And yeah, I can definitely attest to that myself, because I finished my program, I think maybe in March or April of this year. And I think the result that I ended with at that point in time, it hasn't changed. And, you know, I don't think it's going to. And so, and like you said, I think, yeah, it is interesting. It's a very subjective line where, you know, is it successful or not? It's really up to kind of you and your mind and how you feel. And it's also a slow process too. It's not like a quick switch, because sometimes it takes, like, I felt like in my particular case, it took like a combination of you know, doing the bracing, actually seeing an actual improvement in the chest, and then also, you know, the exercises and working out and fixing the posture, and all of that combined together. Then coming out of that, sometimes it takes a few months to realize that you know, oh, I'm not really thinking about my chest as much when I'm walking around with a shirt on, and so it's kind of an interesting process, but.
I think you're right. It is a slow process, and sometimes you also have to go back and look at how it looked before, because we as humans, we do have a kind of a great we have great memories, but we have terrible memories for problems and issues. And so once you've got over them, it's like, you know, if you talk to someone who's had a really bad knee injury, you know, after a year, they, oh, which knee was it? Which one was the one? You know, yeah. So, but they hopped around for 6 months on a knee injury. So so it's good to show people the original 3D scan. It's good to show people pictures to say, this is what it was like before, and this is where you are now. But I've had a few cases of people, a few sort of teenage lads who've walked out of the clinic room with the shirts off. That's rare, but that's kind of the extreme case of people being super happy. But yeah, I think you're right. You have to sort of reflect on these things and think, how has it made me feel? How has it made me feel in different environments, at work, and, you know, with my friends, with my, you know, partner? So it's only after a period of reflection that can you really see the sort of benefits of it. Yeah,
that's true. And that's true. I have to sometimes remind myself that, you know, I honestly don't think about it as nearly as much as I used to. And maybe it's easy potentially to even take it for granted. Like, you know, I went through this extremely arduous process, and, you know, it was something that, you know, meant a lot to me and bothered me quite a bit for such a long time. And, you know, it's only been about 6 months that I've had this kind of, you know, freeing of the mind, but it does really take, you know, some looking back and on how you really felt, and then you realize, wow, I've come a long way. It's actually, you know, a big improvement. So that's a good point.
So are you going to tell us a little bit about your journey then, Sean? Are you going to give us a bit of you tell us your story?
Yeah, so I can go into my story a little bit. I guess so again, for context, I started bracing when I was so I started bracing with Sam when I was 26, you know, during the pandemic. Came out at 27, took me a little bit over a year. Actually, that was the second time that I had attempted bracing. I had done it once before when I was maybe 21 or 22, and I did it with a different provider. And that one didn't work for me, mostly because of compliance. I braced for about 6 months, and then it was just really uncomfortable for me. Maybe it was, the quality of the brace, maybe it was just my lifestyle, but I ended up stopping after 6 months and didn't get really any result from that. And then some time passed, and then, it's kind of interesting too, that you go through like waves where there's periods of time where it bothers you, and then there's periods of time where it just goes away and you kind of accept it and you kind of forget about it, but then it always kind of comes back. And so it came back for me, I guess, maybe a few years ago, and then I was looking into some serious options, and then I came across LOC and Sam, and ultimately decided to go through with the process. And yeah, I mean, I will, a lot of what I say, Sam kind of already mentioned, but I think it's largely a mental process. I think it's mental and physical, but I almost think the mental part is more than the physical part. Obviously, the physical part is extremely hard. You're wearing a bulky brace. Sometimes people are wearing 2 braces 23 hours a day for literally months, sometimes beyond a year, and and you're exercising, and so it's physically extremely taxing, but mentally it's also extremely taxing and psychologically. And I think the other thing that I'll mention to people is that it's also important, whoever's going through bracing is like to have, I think, people around you that like you can at least talk to or tell, or to not be completely alone. And you won't be if you work with a provider like Sam, but I think having people close to you know as well is helpful when you have those moments where it's really uncomfortable, you just want to take it off. Just having some sort of support system is helpful. So yeah, I mean, I can go in a lot of different directions, but yeah, Sam was extremely helpful throughout the entire thing. And there were ups and downs. I had some period, I had a several week period, or maybe even several months, where I had a lot of skin issues. And I think you remember that, Sam, where I had to take the brace off.
Yeah, it really took quite a lot to get on top of that. And I think that's one of the important things about having a kind of someone guiding you through the process, especially with you're putting a lot of force on this bone, and the interface is your skin, and so of course it's going to get red, and it's going to get sore at times, and painful. And having the ability to say, hey, look, this is a problem, can we try and fix it, and trying to change the direction of the force, trying to offload areas, it's not easy, because it's hard. You've got to push down on that point to correct it. But sometimes there are different techniques we use to try and kind of like, well, we're going to go over this area, go for a week or two, and then we're going to come back to that one once it's healed. So there are sort of strategies to try and reduce that, and that can massively play into the psychological element of it. I know a lot of my patients get very down when they get this skin's broken down, and so we have to kind of react relatively quickly and try and solve those problems, because that plays into how their compliance at the end of the day.
Right. Yeah, it's super true. Yeah, I remember I had those periods where it was, I feel like my lowest period was definitely when I had my skin issues, and it just felt like it wasn't going to go away. And then fortunately I was able to kind of figure out like a routine that kind of helped me. I put some pseudocreme and some baby powder, and that kind of helped clear it up, and extra padding. I know you and I went back and forth on the padding design, and I was really appreciative of you answering all my requests. I know I had a lot of changes to make, but
it's important that you have to go through those sort of iterations, I think, sometimes, to get what people want, and you have to, and it's okay to try something even if it fails, because you've tried it. You just can't, you've got to do it. I think the other thing that really helped you, and it would be good to hear about it, is your exercises, because you did really get into them.
I did. Yeah, that's true. Yeah. And yeah, the exercise was a huge component for me. And so I guess the way I went about it, and most of it was, pretty much guided, instructed by Sam, but essentially the first kind of phase, I guess, from the beginning of the bracing period, up until maybe midway, 6 months or so, was really just working on flexibility exercises. So using bands, using like small weights to really just kind of, and breathing exercises to open up the chest while you're in the brace. And I did that for probably 1 to 2 hours a day. Try to do it every day. Of course, not, sometimes missing here and there, but I did that for many months. And then I entered sort of, I guess, maybe the next phase about 6 months in, where I switched to more like heavy lifting weights. And I guess the idea there is to kind of sort of cement the result as your bones sort of kind of remodel, kind of keep them in place. And so I kind of I went pretty serious on it. I hired a personal trainer. I was, I did like full body workouts, try to gain weight at the same time. And that was helpful for me too, in terms of like confidence and just, I've always been kind of a skinny guy. So the combination of changing my chest plus kind of adding on weight, and it's all, it's synergistic, they help each other. So
yeah,
and that really helped me. And I continued that through the end of the program. And, I still, work out today. So picked up a great new habit too. But I think that was critical to my success as well.
Yeah, I agree, and I saw the changes happen as well, especially when you got into the weight. Suddenly you got a bit more buff, and it was good to see, and you can see the confidence that comes from that new kind of like that shape. And we all know exercise helps mental health as well. So you're kind of you're helping yourself through the process psychologically as well, just from the natural endorphins that you get from exercise. So then psychologically, because I know this is like a big thrust of why you want to sort of reach out and do these things, and there's only so much we can do in terms of talking to patients, but what really kind of like helped you psychologically through treatment?
That's a good question. I mean, I think it's a lot of it is, maybe, I don't know if this is a good term, but like maybe like mental toughness, or like perseverance, and like the ability to get through those tough periods. And it doesn't necessarily have to be just yourself. I think if you need support, then I think use that support to get through those periods. But I think for me personally, just thinking about like how much I did want to change, and remembering why I did it in the first place. And I think that goes back to the point that, to really get a result, like the person bracing has to want the change. Otherwise, when you get to those difficult points, it's going to be too easy to just kind of, give up or lose progress. And so I think for me, I really wanted the change. And so even when I was at a low point, I really went out of my way to try to find a solution, whether it was, calling up somebody else who I knew who went through bracing and saying, hey, what did you do when you had skin issues, or talking to you, Sam, or trying to solve through the issues. So I think it just goes back to wanting the change, because that drives, the motivation and the compliance and everything. And so I think that was my case.
I think you're right, because I feel when I talk to people is that a lot of the time I'm sort of asking them to take a huge leap of faith. Just keep going, just wear it a little bit more. Just do your exercises. I know you don't want to wear it in front of you like the lads at football, or the kind of the people you're going out with tomorrow night for dinner, but you have to, and just keep doing it. And the reason you have to, because it will work, and I've seen it work lots of times. And that leap of faith, I think, is a lot to ask people to do. And I do think that the community that is kind of getting bigger now with adult patients, of patients who've been through treatment and have had a successful result. And I know you reached out to one of our kind of earlier adult patients who had done a bit of a blog for us. I think that I see that help massively, because of course I'm going to say it works. I'm just a guy selling braces. You need to kind of like speak to someone who's real and has been through it and has no vested interest in it. No, I'm not just a guy selling braces. I want to genuinely help people, but that is the way it could be interpreted. Yeah. So I think this forum, other forums that allow people to communicate and ask difficult questions, and ask, how long did it take you? And I'm at this stage, what happens next? And, I just don't want to do it this way. Is there any other way of doing it? Can I take it off for 5 hours a day and expect to get a result? Will it just take longer? All those questions, we can answer them. I can, but sometimes it's better and more credible coming from someone who's actually been there and done it.
Absolutely. Yeah, yeah, no, that's super true. And yeah, I remember, when I talked to former patients, yeah, it helped a lot because it's a value. I mean, it's a necessary perspective. Um,
Mm.
yeah, so that's why I'm glad to be able to, kind of give back to the community a little bit in this way that we're doing now,
Mm.
and hopefully more in the future. But I guess we have, a few more minutes, and there's a few
Yeah,
questions. So if it's okay, I'll kind of go through some of the questions some of our audience
yeah.
members have. We can kind of answer them. I guess one of the first questions, it says, is there a known genetic component to Pectus carinatum? I think maybe you touched on this
I
earlier,
think,
but
yeah, I think, I'm not a geneticist, but I think they call it familial. So it is something that you definitely see in family traits. I don't know if there's a known genetic component to it. But, I've seen, in fact, the first patient who came through the door, and they attended, we gave a lecture to the Royal Society for Medicine. We had, I don't know, not many, but maybe 5-6 consultants in London. And Dr. Hodge came over and he gave the lecture with me. And a woman came up to me afterwards and said, "Oh, I've got, my son's got it." I don't know how she found out about the lecture. It was only really to medical doctors. But she found out about it and she brought her son in, and he went through successful treatment. And then I saw each one of her other 4 children with all various different kind of components and severity. But, and some of them, we didn't really do much treatment, but we monitored it and we just used a very gentle brace on an 8-year-old to do some exercising, and that was enough. But we treated all of our children, so there are definitely genetic components to it.
got it. Next question is, did you see, and I'm guessing this is for me, did I see any improvements in my breathing? Did I have any anterior posterior pelvic tilt? Any improvement in this? I guess in my breathing, I didn't necessarily notice any difficulty in my breathing before bracing. I think for me, it was really just mostly cosmetic, and then posture. I think like Sam said, I kind of had kind of the forward posture, especially combined with me always being skinny. And so that was kind of really the big issue for me. And I saw improvements in all of that. And so maybe there is some, so maybe I just don't notice, maybe there is improvement in my breathing, but I think fixing the bracing does kind of fix the posture and maybe any other kind of kinks I had in my body. And so I think generally, overall, I feel a lot more confident about the way my body kind of appears now after the program, and also combined with the exercise. So I definitely would say I saw a big improvement in that area personally.
I think from the breathing perspective, I mean, a lot of the exercises that we do have to go hand in hand with a very deep breath. And so a lot of my patients do, report that they feel that their breathing has improved just because they're taking deep breaths. And how often do some people take deep breaths? It doesn't, so I think the breathing does improve, especially for the excavatum patients who perhaps have more of a feeling that their chest is being constrained. And with regards to the posture element around the pelvis, I think that we're always trying to normalize posture, and we're trying to improve. Certainly, when we look at the body in the frontal plane, look at the front, we want to kind of create symmetry because our body works well with symmetry. And then from the side, there are kind of normal curves that mean that your head and your shoulders and your pelvis and your knee and your foot are all balanced. So we're trying to kind of normalize posture from that perspective as well.
Makes sense. So the next question we have here, for early onset cases in girls, when is the best time to brace?
Well, I think the earliest case that I have treated is 6 years old. Now, there has to be a degree of, first of all, you have to have compliance to put a brace on a child. Second of all, it has to be done so gently. You don't want to you don't want to give a child a psychological problem at that age by thinking that there's something that you're doing that, or they've got a problem. And because children don't care, they generally don't care until they're 12, 13, and that's almost all the time. They know they've got a problem, but they don't care about it. None of my friends care. I don't care. 12, between 13 to 14, they begin to care, and 15, 16, they really care. And that's generally what happens. They're obviously, people who don't care ever. But so you can treat very early. You can but you have to do it incredibly gently. You have to have everyone on board, and the child has to almost think that it's just part. It's like brushing their teeth. It's just like something they're going to do every day. Wear a little brace for an hour while they're reading the bedtime stories or doing something, and then maybe you can kind of like avoid the more sort of aggressive form of treatment later on with the 23-hour a day wear. But it's a long-term commitment, because you're looking to really know that patient until they're 15, 16 years old.
Yeah, right. That makes sense. And then I guess the final question we have here, is there a correlation with pectus issues and certain body types?
Oh, that's a good question. I've noticed, this is a really there's no evidence behind this apart from just anecdotal me noticing it. I've noticed a correlation between pectus, chest shapes, and very flat feet, specifically with a rotation within the midfoot that causes the big toe to be slightly shorter and sometimes elevated. Now, it's a kind of a foot problem that goes unnoticed. You'll know that you've got flat feet, you've got reduced arches, but if you correct that arch, then the big toe wants to come off the floor. And so in a unusual amount of patients, I give them insoles sometimes as well to try and correct that. But it typically, that my sort of like young adolescent group are very tall, rapidly growing, skinny teenagers. That's because you see it, and it happens almost before your eyes. I think sometimes with some of these boys who are growing rapidly, and they all have like stretch marks on their back because they're growing that quickly as well. So I don't. So yeah, I would say there is a correlation with some body types, but I don't think there's any evidence to sort of categorically say that.
Interesting. Okay. So yeah, I was curious about that too, because I hear a lot, and you hear like when people on the forums and whatnot, that it seems like the tall, skinny type is the type that gets pectus, but I guess you're saying to some extent that may be true in what you see.
Yeah, I think definitely. I think that rapid growth at such a rate, when it's then sometimes maybe that's not constrained very well within the chest, or so I think that does perhaps have something to play into it. But there's plenty of tall people who don't get pectus, and I've met plenty of sort of average height people who've got it as well. So it doesn't, it may be a trend, but it's certainly not the rule.
Yeah. And I guess looks like one more question. For someone who is in the US, would you recommend that they how would you recommend that they get in contact with you? You're, I guess, based in the UK, someone's based in the US. What would you recommend in that case?
So we can, you can reach out to us. We can have a chat online. We can talk about our treatment. We can give you quite a lot of advice. There is a lot now that we can do remotely. It's phenomenal how technology has moved on. My patients are now able to take 3D scans using their iPhone. We can really evaluate the chest wall very carefully doing that, and also we can look at the flexibility just through sort of some tests that we can do online. And then once we've done that, we can really give people a good understanding about what the treatment would involve and how we would go about it. So I would say, reach out to us and we can talk you through it.
Got it. And yeah, again, you can find Sam at London Orthotic Consultancy. I think it's in the registration link and whatnot. And after the webinar is over, you guys should all get an email with my email contact as well, so you can ask me directly any questions. I can help direct anything. But yeah, I think that's about it. We're about at time here. Let's see. Yeah, so I mean, Sam, any final parting thoughts?
I mean, only to say thank you, Sean. I think that your experience that you share and you went through was a pretty remarkable transformation that I watched in terms of you going through it. I thank you for sticking with it because I know there were dark moments where you really struggled, and I hope that you by doing these types of things, you do, enable other people to stick with the program as well. Hopefully they're my existing patients and they see this and they think, yes, okay, Sam's kind of like mantra that he's been telling me is true, and I'm gonna stick with the program. But so I think it can definitely help other people get there. I would say that Pectus is it's not the worst problem that anyone can have in the world, but it can be really important to fix it. The earlier the better, if possible. But if you do come to this late in your life and you want to give it a go, we can maybe discuss it and talk you through it and see if it's a possibility for you.
Great. Yeah. And yeah, thank you as well, Sam. I mean, I remember when I first came into contact with you, it was kind of a breath of fresh air after speaking to, some of the other options out there. And I knew immediately you were the real deal. And here I am kind of on the other side, several years later, and we're still in contact and I've got a good result. So yeah. Very, very happy about that. So thank you too.
Pleasure.
All right. So I guess with that, we'll kind of wrap up. But yeah, thank you for everyone for joining. And we're going to be, hopefully continuing this sort of series going forward. So whether I have more, people on the, clinician side, or people hopefully as well, like myself, who went through bracing, I'm going to be trying to get a collection of people to share more perspectives and give more information about this condition to the public. And so feel free to email me too if you have questions, or if you have requests, if you want to hear from certain perspectives, please let me know. But I will keep you guys all updated for future events. All right.